Canada, if you've been watching this week, we talked about this, is asking the federal government to ease some international travel restrictions. Air Canada wants the government to back away from a blanket 14-day quarantine and instead establish criteria to exempt certain countries based on their domestic COVID-19 profiles. Let's dig into that in more detail now. Dr. Chung is the Chief Medical Officer at Air Canada, and he joins us now. Dr. Chung, thanks very much for being with us this morning. We appreciate it.
Well, thank you for having me.
Let's start with your role of Chief Medical Officer. I'm not sure everybody knows about what a role like that would entail. What is it that you do as part of that role at Air Canada?
Well, I'm responsible overall for the medical health and safety aspects of Air Canada. There's a significant regulatory aspect with respect to the aviation sector, including both our pilots and our flight attendants, as well as the in-flight medical emergencies. So those are just a bit of the duties that I am responsible for.
And as we mentioned, Air Canada have been in the headlines this week as part of this ask, if you will, of the federal government to think differently about quarantine when it comes to different countries where people might be traveling from. Can you elaborate on what you would like to see the government do and why?
We would like them to have a conversation and just really look at the quarantine and look at it from an evidence-based and a science-based approach, as opposed to a one-size-fits-all policy. At the beginning of your segment here, you mentioned a number of cases coming in from different countries, some of which were high risk and some of which were low risk. So certainly, we want to have that conversation and look at it from an individual country and a risk-based assessment and an evidence-based assessment.
And how do you go about doing that, I think, is the question that some people might have, because in theory, I understand what you're saying. I guess in practice, how do you go about executing on that?
Well, I think, firstly, I think we would have to have all the stakeholders involved and have that discussion and set up parameters on what we think are low risk and high risk countries based on the community transmission levels within those countries, whether they're similar or the same to Canada, if not lower, on a per capita or population adjusted basis. Do they have underlying reasonable public health facilities and contact tracing and the infrastructure set up similar to Canada? And have they been doing testing at a comparable level so that we can trust their data that they're producing? So these are some of the guidelines that have been documented, certainly within the EU, as you're aware, in conjunction with the European CDC, or Centers for Disease Control, for safe travel or travel bubble, if you will, from these European Union countries and countries like Canada. So we're just asking for an evaluation, sort of, if not the same, but at least have that discussion for starting off with that.
Dr. Chung, I wonder if you could give us some examples of countries that might be doing, quote unquote, better on the COVID-19 front, and what kind of quarantine might be more acceptable, in your opinion, for that country or those countries versus other countries?
Okay. Well, I mean, certainly, like certain countries that are comparable with levels to Canada would be not indifferent or much different than, say, interprovincial travel from Ontario to the BC, for example, or from BC to Ontario. If you have a similar country with similar community transmission characteristics, I think Italy's settled down quite a bit. Greece is at very low rates, and then countries that are a bit higher, then we should have a discussion and conversation on what are the requirements. And as you've noted, it's on the earlier part of the segment, it's difficult, if not near impossible, to track travelers coming into Canada with the quarantine period. We don't have the resources and manpower. And as testing capability ramps up, we should be having that discussion with respect to testing either prior to departure and testing on arrival. But some sort of a combination may satisfy, reducing the risk to a reasonable amount, or even lower, if not extremely low, just to make Canadians comfortable.
We highlighted those comments from the Prime Minister, who didn't seem to show any interest, at least for now, on easing flight restrictions, generally speaking. What can you say about this conversation that you are having with the federal government, if you're having it at all? I mean, what stage are the talks in?
Well, we are in regular dialogue with both the Ministry of Transport as well as the Public Health Agency of Canada. However, regarding this letter, we haven't had any conversations to date.
And what has been your experience with people who are flying with Air Canada, with the airline, maybe even your own experiences? I mean, have you been doing any flying? Is there anything you would say about the flying experience for those who see the headlines, see the news, and do have worries about the health risk about getting on a plane right now?
Sure. There's it's an individual decision, firstly. But secondly, there is a multi-tiered or multi-layered approach to safety that we are taking and undertaking, though. And it starts really at the curbside with ensuring that only those passengers that actually have a boarding pass are allowed to enter the airport. Social distancing, frequent hand sanitizer available, contactless check-in as much as possible through the requiring of wearing masks as well as temperature checks at the airport, and a health questionnaire assessment prior to receiving their boarding pass and an assessment at the gate. So, there are sort of, as well as wearing masks on board the aircraft. So there are sort of a multi-layered approach to reduce the risk as much as possible.
And Dr. Chung, maybe you could weigh in, since you come at this from the medical perspective, on the middle seat. Now, this is not just an Air Canada issue. This is an airline broadly speaking issue. I mean, obviously, airlines are financially challenged right now, but it felt like many in the industry moved away from having essentially that social distancing in the seating on the planes as quickly as it was implemented. For those who are wondering about traveling and have heard that, middle seats are no longer going to be empty, what would you say?
Well, I'd say it's an individual decision or choice. What we've decided to do in Air Canada is to advise our passengers who are booked and checked in, if the load capacity is beyond 70%, to allow them to rebook if they're uncomfortable with that. Having said that, the seat distancing really is, middle seat is only really 18 inches of separation, an additional 18 inches. And I would sort of go back to looking at the data and the evidence on onboard transmission. And, to my knowledge, there have not been any cluster outbreaks on board any Canadian aircraft, in my discussions with various public health officials. And this is going back. This is even going back to February, March, when we had a lot of travel and a lot of passengers traveling without all these onboard precautions that we have currently. And when we were, there were probably likely more cases.
Dr. Chung, beyond having this conversation with the federal government, is Air Canada having a dialogue with big corporations and businesses as well? Obviously, your CEO, Calin Rovinescu, has talked about how hard the industry has been hit and how long it will take to get back to some kind of normal, while individual travelers might be, hungry to travel again. Some companies have had blanket policies during the pandemic, which might extend for the next year or so. So do you equally have to have a conversation with business customers and the corporate companies that are okaying that travel right now about the health and safety risks?
Yeah, I fully appreciate their concerns as well. I think those are discussions that are ongoing with our commercial branch, with their corporate clients, but that's outside of my purview.
Dr. Chung, thanks for your time. We appreciate it.
Thank you.
It's Dr. Jim Chung. He's the Chief Medical Officer at Air Canada.